This is Geske and Michael Cullen. We're reporting from ACC 14 in Washington, D.C. Mike, it's good to be back.
It's great to be back here, Jeff. We've got a lot lined up for this conference. You can see we're standing in front of the Capitol. We're about to speak with some representatives who are physician members of Congress. We've also going to interview a lot of the ACC leadership and late-breaking trial presenters. It's going to be a great meeting.
With all the talk going on with regards to the Affordable Care Act, how do you see that impacting cardiac patients and then cardiac providers?
Well, I think it's going to have a very profound impact because there are a number of major changes. One of the things that's happened with ACA is I believe it's accelerated a trend that was already in place whereby physicians were leaving private practice in droves and moving toward employment models. And I think this is accelerated now under ACA because the mismatch between cost and reimbursement has not been solved, and physicians are having trouble meeting cost. And if they can't run their businesses, the business side of their practices, they go over to the hospitals. I think this creates a potential for serious conflict in interest because what you want most is a physician who's acting independently in the interest of their patient and putting the doctor-patient first.
Over this next decade, we're going to redesign a healthcare delivery system. I think it's incredibly important for young physicians to get involved because you possess a very unique perspective. Plus, this is the healthcare delivery system that you'll spend most of your careers in. So it's incredibly important for young physicians to express their opinions.
If you think about the principles that we want for our healthcare system, whether it's having a system that's affordable or accessible to everybody or of the highest quality or choices that patients want, all of those things, I believe, are violated by the ACA.
I think at the end of the day, what I try to focus on is how does it affect the patient? And that's what I think physicians try to focus on. The things I'm doing here in Washington, I'm trying to decrease the bureaucratic paperwork that physicians have to do in order to take care of patients. But, it's an unsettling time right now in how we pay for health care. But I'm still optimistic about the future. I think healthcare is a great profession to be in, and I still tell young people to consider being doctors.
Mike, this was really a great experience talking to members of Congress. What's something that you really took away from this?
Jeff, most members of Congress who were physicians really enjoyed the opportunity they had to serve the public. They really felt that the skills that they used as physicians translated well to Congress. There were obviously some frustrations, but overall they were very optimistic about the future of healthcare, despite all of the doom and gloom that we hear coming out of Washington.
It's an exciting time. More videos on Fits on the Go at youtube.com/FitsOnTheGo.